Hello, Hannah Mackay here. For the next few days I'm going to share a little bit about Shiatsu during pregnancy. This is part of my work that I really enjoy, working with pregnant women, and I'm looking forward to getting back to that at some point. What I'm going to start with today is showing some points that we can use at the end of pregnancy if we want to encourage the process of labour and birth to start. So these points are contraindicated, so we shouldn't use them during the rest of pregnancy because they encourage labour to begin. The points have different effects that they would give us at other points in time. So they're not just used to relate to labour, but I think it's quite useful to use this set of 4 points that I'm going to show you today if you're certainly 40 weeks of pregnancy, or maybe if you're around 38 weeks of pregnancy, to try to encourage all the different processes that are involved in going into labour to begin to start. So the first point that I'm going to show you is large intestine 4, which is just here on the hand. So large intestine 4 particularly helps us to move things out of our system. So it can also be used for things like constipation, but there's an obvious use there during the birth process. Because birth is such a strong physical experience, generally we would use these points quite strongly. We're not trying to force something to happen, but we're trying to get into that real physical engagement with the body, getting the body's processes to begin in a timely way, to move anything out of the way that might be stopping that. So large intestine 4, you could hold this for about a minute. You do it on yourself if you're a pregnant woman, or you could get your partner, somebody else in your household, to do it for you. So that's large intestine 4. The next one is Gall Bladder 21, which is a little bit more difficult to do on yourself. It's right on the top of the shoulder, on top of this muscle bulge here. It's halfway between the spine and the edge of the shoulder. And if you're working it on yourself, I think this kind of motion of going into it and releasing is quite good, because otherwise it builds up too much tension in yourself if you really try to lean into it on yourself. If you were working it on somebody else, just stand behind the person and bring your weight down onto their shoulders if they're sitting is quite good. The next one would be Spleen 6. So that's on the inside of the leg. We find the ankle bone here. We measure 4 fingers width above the ankle bone, and it's in the flesh here just behind the shin bone. So we don't want to feel the bone when we go in. It's just a little bit further back than that. Spleen 6. And this one particularly connects with the uterus, with getting the contractions going. It's also good for period pain at other times when you're not pregnant. So that's Spleen 6. So again, holding with these maybe for about a minute. You can do one side then the other if you're working it on yourself. If you were working on somebody else, you could do both sides together. And then the last of the 4 points that I'm going to show you is liver 3. So that's on the top of the foot here. So between the big toe and the next toe, coming up here into this gap. That's liver 3. Liver 3 is particularly good at moving any horizontal blockages in the body and releasing frustration and anger, if that's there for you at the end of pregnancy. That's quite common. Impatience. So that's liver 3. So that's 4 points that we can use to encourage the process of labour to begin.